So we now move on to the Dr. Jivraj Mehta oration, which is to be delivered by Dr. Rupin Shah. He is a soft-spoken, dedicated andrologist and a die-hard adventure enthusiast. And he is going to speak on developing andrology, serendipity, and life lessons. To chair this session, we have Dr. Sangeeta Rawat and Dr. Sulabha Punekar. May I request Dr. Sujata Patwardhan to kindly escort our speaker and chairs to the dais. I think we have eaten something, audience. A little more Josh. Thank you. That's better. I request Dr. Sujata to now welcome all our dignitaries with a box of Tirgul. And I'm sure Dr. Shah is going to agree that God Bola is extremely important in andrology, especially in making couple relationships work. Thank you, Sujata. We are also honored to have with us today our donor, Madam Durga Mehta, who is a niece of Dr. Jivraj Mehta, and she has instituted the oration in his name in DGST. She is 93 years old and she's been associated with KEM for nearly 40 years. She was a matron here before she left to take on other responsibilities. She has come all the way from Amreli. We also have Dr. Jivraj Mehta's eldest grandson with us, Sri Jaydev Mehta, who has come for this oration specially from the US. And he has retired from the energy industry and he with his two siblings live in the US. We also have another grandchild of Dr. Jivraj Mehta, Dr. Bharti Modi. And I request Dr. Sandhya Kamath to felicitate our donors and our guests with a small token of appreciation from KEM. I would now like to introduce our chairs who are the face of KEM. Dr. Sangeeta Rawat is our dean and driving force of this centenary event. A neurologist and an epileptologist at heart, she is spearheading the Comprehensive Epilepsy Care Center at KEM, and she is the current president of Indian Academy of Neurology. She has made software in several educational films for patients of epilepsy to reduce stigma and increase awareness. Dr. Sulabha Punekar retired as professor and head urology from KEM after successfully establishing a center of excellence for microsurgical recanalization of the vas, and she has developed several microsurgical techniques. She is currently pursuing life lessons in fitness, something I feel is essential for all of us. I will now request Dr. Sangeeta Rawat Madam to tell us about the visionary and founder of these twin institutes, Dr. Jivraj Mehta, and then Dr. Sulabha Punekar to introduce our orator, Dr. Rupin Shah. Dr. Sangeeta Rawat Madam.
AV, please. So good afternoon all, and again a warm welcome for this centenary function. And what could be better than starting a Jivraj Mehta oration, who was our first dean and a founder of our sethgsmc Medical College in KEM Hospital. And we are lucky that today we have his grandson and Durga Mehta, his niece, who are there to witness this grand occasion of having Jivraj Mehta oration starting in our centenary year. So who was Jivraj Mehta? He was a visionary physician, an administrator and a statesman who played a pioneering role in shaping the modern medical education and governance in India. Born on August 29 in 1887 in Amreli in Gujarat, he had some financial constraints, but he excelled academically so well. And then after getting his degree in Grand Medical College, he flew to London and he got his FRCP from London and Cambridge and became a fellow of Royal College of Physicians. As a medical professional, he served as a personal physician to Mahatma Gandhi during the India Freedom Struggle. And I was told the Dean's Bungalow, where I stay currently, he was staying there. So I really feel privileged that we are staying in a place where such illuminated people of India has stayed. And it was the same place from where, after becoming a dean in 1942, he was arrested for and he was in a jail during that 2 years. So what a freedom fighter person we had as a first dean. And then when he was out from there, he was initially, again he wanted to become a dean, but then he was told that he has capacity to much more higher than just becoming a dean of the institute. So then he served as a financial minister, and then he became the first chief minister of Gujarat. So that was the biggest thing, that we had our dean who became our first chief minister of Gujarat. And so we always feel proud that KEM has been headed always by such visionaries, such leaders, and that's the reason why KEM is progressing so well. So beyond medicine, he also had a role in policy making. He served as his contribution extended to diplomacy as well. So he served as India's High Commissioner to the United Kingdom from 1963 to 1966. Throughout his life, he was committed to nation building, blending his expertise in medicine and governance to improve the lives of countless people. He passed away on November 7, 1978, leaving behind an enduring legacy as a pioneer in healthcare, education, and public service. His contributions remain a source of inspiration for generations to come ahead. So, with this kind introduction, I thank Jai Mehta and Durga Mehta and them for coming here for this oration and giving us the opportunity to thank Jivraj Mehta for his contributions to KEM and his contribution to the country. So, and we can't have a better person than Rupin Shah to give this. I think I invite Sulbha to give, talk about the Rupin Shah's intro. Thank you.
Thank you. The Dean, Dr. Sangeeta Rawat, dignitaries and friends, I bow to 100 years of excellence of these twin institutions. I offer my sincere wishes for growth and prosperity of institution, and I wish it to be a prime center of knowledge and healing. I also wish the students, teachers, and the staff of these institutions to achieve excellence and achievements for next centuries to come. I thank the organizers for giving me this opportunity to introduce our speaker today. Dr. Rupin Shah is regarded as a pioneer in the field of andrology in India. Dr. Rupin Shah is the only urologist who is exclusively practicing andrology since the time he has completed his MCH in urology in 1986. He has several firsts to count for his achievements. In the initial years, his laborious efforts and his sincere perseverance with the subject, he found some shape to the present achievements. After scrupulous and alert clinical research for nearly a decade, Dr. Rupin Shah succeeded in developing what is called a Shah Penile Prosthesis. Today, this is the most used prosthesis in India and many other countries. This was the first landmark. Today, Shah prosthesis is the most cost-effective also, perhaps all over the world. Perhaps Dr. Rupin Shah always preferred to live outside the comfort zone. He now started learning a new field, and that was microsurgery. Dr. Rupin Shah was the first Indian doctor, Indian surgeon, to be trained in Microsurgery Institute in Lyon, Belgium. Over the years, he has developed expertise in the microsurgical procedures in all male reproductive procedures and surgery. Today, he is the most versatile surgeon andrologist of the country. In spite of his busy schedules, he continued in academics. In last 3 decades, he is conducting most educative andrology workshops in India and outside. Such a multifaceted personality who has earned numerous laurels was conferred on the highest accolade in medical field in India, Dr. B.C. Roy Award by President of India. It is befitting on this occasion to share with you all that Dr. Rupin Shah, an illustrious personality and eminent andrologist of the country, who has many laurels to wear, is an alumnus of GS and KM for his entire studies. While he was student of MCH, his research lab was just a bed in the side room corner. That was year 85 and 86. The era was pre-computer era. NPT machine was yet to come. He used to struggle and borrow black chymographic drums from physiology lab and get the tracings. The days he could get good tracings, his face always used to be gleeful. I was fortunate to witness his initial dream of andrology seeding and sprouting in this ward side room of urology department. Today, like the shining and guiding star, North Star in the sky, Dr. Rupin Shah has made a bright and sound position for himself to guide the aspirant andrologist of the country. Please join me to welcome Dr. Rupin Shah and request him to deliver his Jivraj Mehta Oration, Developing Andrology, Serendipity and Life Lessons. Dr. Rupin Shah.
When they said they need a towering personality, I did not realize they meant they would give a podium. So this is a promise that I'll stick to my allocated time. Thank you, madam. And actually your words take me back exactly 50 years ago when I stood in this wonderful institution, not in this hall, but in the Jivraj Mehta Lecture Theatre, as a grand junior for the traditional grand junior elocution. MLT 250 seats, 300 people packed inside with drums, trumpets, balloons, piparas, everything. The cacophony started 20 minutes before the talk was scheduled. It went on non-stop, drumming, singing, shouting through the first 4 speakers, at which point Dr. Manubai Kothari said, I cannot do any justice to the speakers, and the grand junior elocution came to an end. But having faced the MLT crowd, after that, no other elocution debating contest was ever a scare. We went to Mood Indigo IIT, where people were throwing rockets, kid stuff compared to the MLT. And that is how GS Medical has been for me a training ground that has prepared me for all aspects of life. Chairpersons, Dean Dr. Sangeeta Raval, my dear teacher, Dr. Sulba Punekar, members of the Dr. Jivraj Mehta family, senior and junior faculty, colleagues, friends, maybe an odd student somewhere if I can spot one. It's a great honor to be here and give the first oration named after a giant of a man. We've heard a wonderful introduction of Dr. Jivraj Mehta, and he actually epitomized what we heard in the previous marvelous oration by Dr. Rudwadia. A true clinician, humble, honest, hardworking. There was a whole generation of giants who occupied the hallowed portals of this institution, who came from humble beginnings but exhibited qualities that were amazing. Dr. Jivraj Mehta was born in a well-to-do family, but due to a business catastrophe, they were rendered quite poor. His education in school happened free thanks to the vision of the Maharaja of Baroda, who then started in Amreli for the first time in the country, compulsory free primary education. Of course, he stood first in his school. So came the issue of college. Could not afford to send him to college. He went to the Kapol boarding school, where they supported him for lodging, boarding, school fees, books, everything. Of course, he won 7 of the 8 scholarships, and the money which he earned from the scholarships, he was so ethical that he went back to the Kapol boarding school and said, no longer do I want to be a free boarder. I have money from the scholarship and I will pay you back. His trip to London to study further was sponsored by the Jamshedji Tata Trust. 15 years later, when Ratan Tata needed to go to England, Shri Jivraj Mehta, Dr. Jivraj Mehta accompanied him as the physician. This was the year 1916, World War I. The ship they were on was torpedoed. The ship started sinking. In the 50th anniversary Jubilee magazine of this institution is a remarkable description in the words of Dr. Jivraj Mehta of this episode. And if you read the graphic description, it is as if a script writer is preparing the script for a movie. He was on deck on a clear day. Suddenly a boom, the ship starts sinking. He runs down to the cabins to bring Ratan Tata, Lady Tata and the other physician on board. Meanwhile, the lifeboat they were supposed to occupy has been taken up. They had to slide down ropes into another lifeboat. Most of them had burns to their hands. Jivraj Mehta was careful not to burn his hands, and he spent a lot of the remaining hours on the lifeboat, on the fishing boat that saved them, almost hugging Ratan Tata to keep him warm till they reached Malta. In London, of course, he won the gold medal, but that's where he faced the discrimination that brought him back to become the dean of this institution, which was founded with the express statement that only Indian doctors, not in private practice, would be appointed as faculty. So in London, though he won the gold medal, he was denied a residential house post in the London College because the chairman did not want Indian to be mingling with the Britishers. When the dean, Dr. Wright, wanted to do right and said, don't worry, I'll get you a house post in Birmingham, his ego came up. He said, if I'm not good enough to have a house post here in London, I do not want it, and he came back to India. And that was the man who in 1925 was appointed as the first dean of this institution. And as we know, there is something unique about this building. The entire college is in one building. The entire hospital, until we had the extension, in one building. Till Dr. Jivraj Mehta came, the practice was to have different buildings for different departments. He had the vision that we have one department, we will have communication, we will have interaction, and that model was then replicated in many other places. As dean, he was strongly committed to research, fought for research funds, and when the British officers wanted wanted to keep the Indian Research Foundation in Dehradun so they could holiday in Mussoorie. He, with Dr. B.C. Roy, fought to have the research center in a place where all hospitals were present. And that is how the All India Institute of Medical Sciences was founded. So it is truly an honor and a privilege to deliver an oration in the memory of a man whose life was lived on such broad a canvas. And I thank Dean Dr. Sangeeta Rawat for this honor. I'm going to talk about andrology. One, because what more exciting subject than to keep a post-lunch audience up and erect. I half suspect the Tilgul Ladu they gave me had a little bit of Viagra in it. But since you haven't got those, I'm going to regale you with stories from andrology. Along the way, we'll talk about how andrology started in this very institution, how it grew, what were the landmarks, and what were the interesting achievements that we managed along the way. I did not want to be an andrologist. The day I joined the urology department, I'd actually just finished reading a monogram by Andrew Novick, a phenomenal book on renovascular hypertension, and that's what I wanted to do. But fate has its own plans, life unfolds, and that's why the topic serendipity. The first day I joined, Dr. Manu Sopti, who was the lecturer, grabs me and takes me to the side room. And all of you have worked in an institution like KM know that side room is valuable real estate. It's useful for many things. And there in this urology side room was a giant machine, an old EMG machine with an oscilloscopic display. And Manu tells me, Rupin, I don't know why this is here. Sir, that is Dr. Professor Pardanani, has got it from the BRC. It's not working. Fiddle around with it for 3 days. And then we'll tell sir it's not working. We'll get it out and we will reclaim our side room. Fate heard this and smiled. The next day, Mr. Sangvi, who was the engineer from BRC, came to see what was happening to his machine. I told him it's not working, and he fiddled around and found that a fuse was off. So he connected the fuse and the machine came on. So I asked him, what do you do with this? So he grabbed one poor patient who was admitted with a renal stone and instead stuck a needle in his perineum. And Sangvi showed me how this EMG machine was actually meant to trigger the glans penis with a small stimulus and measure the evoked potential from the bulbocavernosus muscle. And in those days, I was a photography buff. Now my dear friend Avinash Supe, who's hiding somewhere, has taken over that mantle, master photographer. But those days I had my black bag camera tripod. And so in this dark side room with the oscilloscope, I kept my tripod shutter on B and took multiple tracings of the EMG after stimulating the glands. And so on Saturday, instead of telling Professor Pardanani that this machine doesn't work, I showed him a series of slides on a subject on which there were only 2 papers published worldwide. So I got punished by putting charge of all andrology. And I must say here that in those days, it was Professor Pardanani who had the true vision of andrology. Before the word was even known to most urologists, the Department of Urology of this institution already had an NPT monitor, and I'll tell you about it. Fascinating device. Already had this EMG. A year later, it got the first duplex Doppler with which I used to measure the blood pressure of the penile arteries using a cuff that was 2 centimeters wide. So, and it was the first and only department of urology to have an operating microscope. So there it was set for me. And because I did this EMG, I was put in charge of andrology. And because none of this was in the textbooks, I was forced to go to the journals to read about what I was doing. And that is how my interest grew. The NPT which he had was an amazing device. Historically, I have to tell you a little about it. It had 2 thin elastic silicon rings which were filled with mercury connected by a wire to a galvanometer. The patient would be admitted in the ward at night, and the 2 rings would be placed on the penis. And as he slept and dreamt of whoever, he would get erections. And as he got an erection, that silastic band would stretch. So the mercury column would stretch and it would become longer and narrower. And those poor medicos who remember some physics will know that as the mercury became longer and narrower, the electrical resistance changed, and that was reflected in a galvanometer. And Urvashi, my wife, still hasn't forgiven me, because every morning when I'd meet her, instead of murmuring romantic sweet things, I'd show her huge ECG strip. Urvashi, look at this NPT. And all her friends would hide their faces because they knew what that meant. So from that NPT, in a couple of years, I was like Andho Mein Kana Raja, the only guy who knew something about andrology. So I thought I knew everything. And then stepped in Professor Prakash Kothari, who is now here. And because I've now known him for 40 years, I'm going to call him Prakash Bhai. In those days, 1980s, when sex was sniggered at, when sexual medicine was in the hand of quacks with big mustaches and stallions outside their doors, he had the courage and the vision to hold 4 national conferences on sexology, creating a scientific platform on which those who came afterwards, like me, could stand on a podium this high. In 1985, he organized the 7th World Congress of Sexology. And it blew my mind, because here were the experts from around the world talking about injecting radioisotope into the glans penis to measure the blood flow and the clearance, talking about electrical myography of the penile muscle, and a fascinating talk on something that changed sexual medicine for the next 15 years. But for that, we have to step back 2 years to a fateful Monday, April 18, 1983, the grand ballroom of the largest casino in Las Vegas. It was the evening special meeting of the Urodynamic Society as a part of the American Urology Association meeting, the largest meeting in the world. The theme of that conference was physiology of erection, and they had invited to that meeting all the way from the UK, a genius, one of the most prominent British physiologists, Giles Brindley. And being a true genius, he worked in every area. He worked in the neurophysiology of sight, developing in the 1980s devices to help the near blind see. He worked on sacral stimulators to relieve pelvic pain and produce an erection, and many other things. And one of the most dramatic things he did was work on intrapenile injections with vasoactive drugs to induce an erection. And like a true mad genius scientist, he tested all those drugs on himself. And by 1983, he was ready to publish his paper, and that's when they invited him to the US meeting. Formal meeting, because after that was a social evening, men in tuxedos, wives were also in tow because of the social evening, wearing gowns, and this British genius comes wearing track pants. That was the first one. Then for 1 hour he showed unbelievable slides on erections following electrical stimulation, intrapenile injections, variety of drugs. Question answers followed. Nobody believed him. So he said, I know you don't believe me. Well, before starting this talk, I have injected myself with an agent. And then he steps forth. Don't look at me, I haven't. He steps forth and sideways shows them the track pant like this. Says, this is what this drug can do. Now here it gets murky. The AUA claims that he took off his pants himself. He claims the chairman asked him, is this real? Either way, Brindley, in front of the AUA, takes down his pants and shows them the erection. And he says, I think some of you are still looking skeptical. You think this is a penile implant. Come touch it and see it is real. And he walks down the podium and walks down the aisle. You can imagine women screaming, men recoiling, complete pandemonium. Today, this is called the 1-hour lecture that changed the face of sexual medicine. But that evening, the AUA almost expelled the Urodynamic Society. But it worked. 1 year before Brindley's demonstration, Virag from Paris, whom also I had the pleasure to work with, had already published his work in the Lancet. Nobody had heard about it, not even Brindley. But after Brindley's demonstration, the next day, Tom Lu, one of the researcher, writes, I went to my lab, injected my experimental monkey with papaverine. He had a full erection. The following week, I injected a man. And for the next 15 years, till Viagra came in 1998, intrapenile injections were the mainstay of diagnosis and treatment of sexual medicine. And we adapted it in our department from 1985 onwards. So almost on the ball. Now what happens is interesting, because this is where our journey starts, where time and again we have innovated and we have brought a local Indian flavor to the work. So Brindley had actually injected phenoxybenzamine, which is carcinogenic, and was stopped. But most people started injecting papaverine or prostaglandin. And that's what we did, papaverine. Soon we realized that papaverine alone was not very effective. And then there was a paper saying combine it with phentolamine, and we started doing that. But very soon, phentolamine was withdrawn from the Indian market. And when I requested a friend from the US, in 1980s, they brought jeans, they brought chocolates, and for me, they brought phentolamine. But shockingly expensive. I had to pay $50 for 10 milligrams. So we started looking for an alternative. We got a hint from an obscure poster from Brazil and from my work earlier with Dr. Samsi. With Dr. Samsi, we very often in the surgery unit used to infuse patients in hypovolumic shock with a dilute solution of chlorpromazine because it was a strong vasodilator, and he believed we need to perfuse the vital organs. So with that experience with chlorpromazine, we tried to combine papaverine with chlorpromazine, and we showed that it was as effective as papaverine, phentolamine, and prostaglandin, with the only difference that while phentolamine cost us $50 for 10 milligrams, phentolamine cost us 10 rupees for 50 milligrams. The work we did on this won the best paper prize. We had 5 Andrology best papers in a row. But again, I encountered another very interesting point. Indians refuse to believe themselves. And for almost 10 years, I used to continue to have colleagues asking me, Rupin, from where can I get phentolamine? From where can I get prostaglandin? And I would tell them, you don't need that. Look at our work with papaverine chlorpromazine. It's easy, it's effective, it's inexpensive. Today, I am proud that it is the standard of care in India. And when I look at many other countries, they either don't have access to this very powerful technology or they don't know how to use it at all. So this was the chlorpromazine story. Dr. Kothari also had one very interesting meeting a few years later. It was the first and only World Conference on Orgasm. The first question everybody asked me is, did you all have practicals? No, we did not. No practicals. But in that meeting, I learnt about the orgasmic pattern of the macaque monkey compared to the bony-tailed monkey. One is monoorgasmic, the other polyorgasmic. Don't ask me which. We had talks on women masturbating during delivery to alleviate the pain of delivery. Amazing sessions. But one that stayed in my mind forever was by Annie Klein. She spent many years in Africa where the most horrendous genital mutilation is standard practice. Pre-adolescent girls would have their clitoris, labia majora, labia minora chopped off by chauvinistic male, stitched together with wooden sticks. Often the hole was so small that menstruation was painful, and you can imagine how painful the first intercourse would be as the scar tissue was torn. So Annie researched these women, convinced that she would discover horror tales of completely absent sexuality. And to a great surprise, she found that these women were sexual, were thriving, and had a great sex life with their partners. And she started her lecture. I always get tearful when I think of it. With a woman on crutches crossing the New York Marathon. And this woman was her analogy for these women who overcame all that mutilation, horror, patriarchal oppression to regain their sexuality. So being in andrology was in many ways a complete eye-opener. Today LGBTQ plus is the buzzword. Pronouns drive us crazy. But in those days, 30, 40 years ago, we were exposed to alternative sexual preferences as normal. We understood that there's a genetic sex, your chromosome. There is a phenotypic sex, the genitalia you have. There is a emotional sex, which is whether you feel male or female. And there's a sexual preference. Are you attracted to a person of the same gender or the opposite gender? And all four could intermingle in any way. And all were variants. In fact, we had a very interesting paper related to that on anorgasmic anejaculation. And we have probably the largest series in the world. There are men, and many of you may not believe it, who have never, ever in their life experienced orgasm, neither during masturbation nor during intercourse. My experience with the first 91 cases I presented way back in 1994 at the World Meeting in San Francisco, and by a great fortune, a few months later, a cousin of mine, while in the Hyderabad Zoo, witnessed a rhino masturbating. It was this rhino with a huge erection, pacing back and forth, suddenly went really horny and started rubbing against the ground and rubbing against the ground, and finally discharged almost a bucket full of semen. And he managed to photograph it all. So in San Francisco, I started my talk with 6 slides of the rhino masturbating, and then linked it to the human mind and how the human mind can very often interfere with what is a normal biological function. And for many years afterwards at world meetings, guys would come at me, you the rhino guy, and the less charitable one would say, you the horny guy. So, and again, the first patient I had, or the first 10 patients I had, my success rate was only 2 on 10, 20%. But at that meeting on orgasm, which Prakash Bhai organized, I met a person called Thor Langfeldt, a Norwegian. Imagine handsome Norwegian god sexologist. Yeah, that kind of a guy. Sex therapist whose talk was on anorgasmia. And the hints and techniques that he spoke about has enabled us over these last 30, 40 years to allow almost 70% of men with this really debilitating condition to finally experience orgasm. One of the other great innovations, not great, but yeah, very important innovations that Dr. Punekar spoke about was the development of the Indian penile prosthesis. Let me see how we're doing on time. Not bad. I forgot to activate my timer, so I have no clue how much time we have left. If there's anybody who can tell me, chairpersons? Okay. Only 7 minutes left. That is terrible. The whole of male infertility is pending still. Anyway, I'll tell you about the penile implant instead. When I started practice in the 1990s, one of the major therapies for people who did not respond to anything else was the penile prosthesis. And 9 out of 10 patients whom I advised the imported penile implant could not afford it. So that started a major quest to see, can we do something? Maybe not as good as the implants we were importing, but something. And I spoke to silicone instrument makers, silicone implanters, plastic surgeons. Nobody could help me. One day I saw the Chabria shunt, which is a hydrocephalic shunt meant for hydrocephalus, made in India. And staring at it, I thought, if they can make this, maybe they can make an implant. And the company was a company called Surgiware, located in Shahjahanpur, 2 hours outside of Lucknow. So I wrote to them and I got a prompt reply saying, yes, we would very much like to collaborate with you. And then for 1 year, no reply at all. One more dead end. Then suddenly the managing director, who actually happened to be a general surgeon, wrote to me, sorry, we were refurbishing our factory and now we are ready to go. And then over 2 years of development, we made the first Indian penile prosthesis. Our first patient was exactly 50 years ago, January 24th, 1994, so 51 years ago. School teacher, married for 3 years, not consummated his marriage, and that's another huge area that we worked in. We did his vascular surgery, didn't help. And we told him, you'd like to try this, it's new, we don't know, no charge, no guarantee. We put in the implant, the surgery was successful, he consummated his marriage, got 2 beautiful daughters. For the first 10 years of after his surgery, even if he had a common cold, he would come to me till I told him enough. Recently he came back, now 40 years later, saying, Doc, I've lived my life, can you take it out? And the implants were still in place, still doing fine. I told him, let the flag fly at half-mast, don't worry. Since then, of course, we had many new developments, and again, the same resistance from our own people. It took almost 10 years before other colleagues started using it. But now, as Dr. Punekar mentioned, it's the most widely used implant in India. It is the cheapest implant. It costs 1/3 of the cheapest implant anywhere else in the world. It has some unique features that makes it very suitable for patients. And it's something that has really changed the face of sexual medicine. I was also going to give you a huge perspective on the development of male infertility, but we've had enough stories. So I'd like to end instead with some words of wisdom. Towards the end of the 80s, when I was finishing my lecturership in the Department of Urology and thinking about whether I should go into the subspecialty andrology, this was a time when, forget lay people, even most doctors did not know the word andrology. And I went and met many of the seniors, and they all told me, Rupin, there is nothing in andrology. It's just 1 or 2 procedures. You'll be very frustrated. So I gave it a lot of thought. And the wisdom that I'm going to share, when you reach 70, you can share wisdom. When you reach 90, you share super wisdom. So the words of wisdom I'm going to share come from the thought process I went through then. And I asked myself that if I have to do andrology, give up urology, which my teachers had trained me so well in, what would it mean? And I think it's important because if there are students here or young residents struggling with the question, should we super specialize? Then what I thought about may make sense. I thought that if I have to super specialize, then one goal should be that the quality of work that I provide to my patients should be of the best international standard. I should be able to stand up in a room of experts and share my experience with equal authority. And today, that is certainly possible. I'm co-chair of one of the international committees which is drafting guidelines on sexual medicine for the world. The second thought was that I must indigenize the problems that we face in terms of demographics, patient population, equipment availability, equipment necessity is different from the West. And I'm proud to say that today we are finalizing Indian guidelines, which are a major departure from what is published in Western literature, because our patients, our requirements are very different. And I feel it is very important in whatever field that we are, that we stand up and say, this is our reality, and boldly, not apologetically, state that this is how we manage and this is the reason why we do it. And if you wish, learn from our book. And the third I thought was that if I learn what I learn, I must disseminate this knowledge. It's very important. Sometimes doctors feel that we have developed a special skill, we should keep it to ourselves. That cannot and should not be the approach. The more you teach, the more you share, the more will your own work be valued, and the more will be the benefit you give your colleagues and patients. Once I was talking to one of the urologists, explaining a technique to him. When it was over, a close friend came to me and said, Rupin, usko to sab bata diya, now he will do it. I said, yeah, but that means the patient will benefit. And that has to be the attitude. So, soon after we started andrology, in fact, the first national conference on andrology was organized by the Department of Urology of this institution, 1988. From the 1990s, we started an annual andrology training workshop in the YMCA, which was perfect. They had a hall, they had accommodation, they had food. You could walk across from Bombay Central. You could take a 20-minute car taxi ride from CST and you were there. Later on, when I started teaching at the Muljibai Patel Hospital in Nadia, the largest uronephro center in the country, in a tiny village, thanks to one man's vision. There, for the last 15 years, we've been having an andrology annual training workshop. 100 to 200 people each year. Over the last 30 years, we've trained almost 4,000 urologists in this field. So my take-home message for the juniors would be, certainly super specialized. Do not be scared if it is new, if it seems that nobody else does it. Down the line, if you have the patience and the sustenance to run the line, you will become an expert with no one else to touch you. For the seniors, one last word of advice, because I've seen senior surgeons with hands trembling, still operating because there was nothing else in their life. Enter Vanaprasthan. Vanaprasthan is when you withdraw and you hand over. And with that, we will truly complete the circle and do full justice to the vision of the giants like Dr. Jivraj Mehta, who have established this fantastic institute. And I'm sure with deans like Dr. Sangeeta and the others who will follow, the next 100 years will be as glorious. So thank you once again for this great honor and this privilege.
Thank you, Dr. Rupin Shah. Yes, if all may give him a standing ovation. We've got so many people who've done KM proud, nation proud, world proud, and a better place to stay. Yeah, come on, 1970s batch, 1966 batch. We need more years. May I now request our chairpersons to felicitate Dr. Rupin Shah with Charles Schrieffer, the Oration plaque, and a small gift from all of us. So sometimes it is these unexpected detours which are necessary. I now request Dr. Sujata Patwardhan to felicitate our chairpersons with a small token of appreciation. May I request everybody to please sit down? Thank you so much. We are also very grateful to Dr. Punekar for being here and sparing the time to come back to your alma mater. Yeah. We will soon be starting with the last of our orations. If anybody wants to buy any souvenirs, they are available for sale in the Centenary office. Thank you all.